everyone. We are going to talk about the coronavirus vaccine today, since it's so topical and coronavirus is kind of controlling our lives right now. Everybody is
Right.
affected by it in some way or another, whether or not
hmm
you agree with the the things that are going on. So we did some research and wanted to talk about the coronavirus vaccine. We are not trying to tell anyone what to do. It's a personal decision.
hmm
But we do encourage people to be knowledgeable about the vaccine because it could possibly save a lot of lives.
hmm hmm
Um, Getting it, vaccines through history have saved many lives. I will start out by saying and sharing, I did get a flu shot a long time ago. I think it's been about 20 years now.
Really? That
And I
long?
had a really bad reaction. It really messed up my immune system, and I was not well for a couple of years, and I still have health issues because of it. So even with that said, I don't try to tell anyone to get it or not get it. I think mine was, one of those odd cases. And it could happen to someone, but it doesn't usually. I don't know about the effectiveness of the vaccine anyway, but I'm not trying to tell anyone what to do. I'm just sharing my experiences and my opinions.
hmm
We did a little bit of research, some facts that you can look up yourself too. So, Kimbra, what are you thinking about this new coronavirus vaccine?
Well, it's funny because a lot of I have a few friends that were like, "No way, I'm not taking it. No way, that's too soon." And I thought my first initial reaction was, "No, I probably will take it." But then I thought, "Gosh, it is kind of soon, and I'm a little nervous about it." But when we were doing the research, or sorry, when I was doing the research for this podcast, it made me feel better about taking it. So I am going to take it when it happens, which looks like it will be December 15th at the earliest. That's just for the United States, and not even I won't be able to get it till next year because they're going to do the essential workers,
Mm-hmm.
teachers, people over 65, that kind of thing. They're
Mm-hmm.
going to do it in that order. So I won't even be able to take it till next year, but I will take it. So I feel better after doing the research about what we were going to talk about. But you may want to share some stuff with us too.
Well, what I found is okay, so supposedly the UK and Scotland are starting to give this new vaccine on Tuesday,
Right.
this Tuesday, which is December, where's my calendar? December 8th
Okay.
of 2020.
hmm
So, we'll let them be the guinea pigs and try first.
Sure.
Um, but the one that they're giving in the UK and Scotland and Wales is by Pfizer,
Right.
um,
Pfizer
and
BioNTech.
BioNTech.
BioNTech. BioNTech. Yeah,
BioNTech.
I'm sorry. That's how you pronounce it. I was pronouncing it
Well,
BioNTech.
I don't really know that that's how you pronounce it, but that's what it looks like to
Right.
me. So,
Got it.
the concern would be Pfizer has a history of fraud in
hmm
healthcare, and they're a pharmaceutical company. They have a lot of products on the market that work,
mm
and work well. I've never been one that likes to take medication,
Sure.
but there's a lot of medications that work and they work very
mm
well and they make help in our lives. So I'm not anti-pharmaceutical industry. I think it's a very valuable industry, but I don't like that when money's involved,
Sure.
then a lot of times they get greedy and try to
Corruption.
sell things. That Pfizer's been sued for giving medical professionals money
hmm
for prescribing their products,
Right.
um,
And pushing them when they
off
don't need
off brand.
to.
They call it, I forget what it's called, off. I want to say off brand, but that's not off
You mean like
something.
generic brand? No, you don't mean generic.
No, it's like they prescribe it for something it wasn't intended
Right.
for.
Like opioids. Sorry,
And I
like
can't remember
opioids.
what the term is, but
hmm
they prescribe it. They were giving doctors money to
Right.
prescribe
No, I knew about
medication.
that case. It was like
Yeah,
it was a case that came to
and
trial.
they got sued and they had a big settlement, and a lot
Sure.
of the pharmaceutical companies do that. And so that's just one of my issues with not trusting completely. And I'm
hmm
skeptical, which we should always be skeptical because our
hmm
history proves that we should be
hmm
skeptical.
Right.
That in the past, there's been fraud, and there's been fraud in many industries. The
That's
tobacco
true.
industry is the biggest one, that they knew there was scientific evidence that it
hmm
killed people and hurt people,
And
and
it was
they sold
addictive.
it
It was addictive.
anyway. Yeah, they sold it anyway. So anyway, with that said, if it makes if we can get our lives back to normal, and I'm not anti-vaccine. I've, got the vaccines when I was a kid and they saved me from serious illness. So I'm not anti-vaccine. I'm skeptical though that it's coming out so soon. But a little
Mm,
bit more research that I found. So you get, when they start Tuesday in the UK, you get
mm,
your first shot, and then 3 weeks later you get the second shot,
mm-hmm.
and then I think within 10 days it's effective. It's as
Right.
effective as could possibly be. But I thought, if you like our videos, go ahead and click on like and subscribe. We really appreciate it. Thanks. Kimbra, what did you find that how about storing
I
it?
know, it's got to be stored in
Cold.
dry ice. It's got to be cold, yeah.
Okay.
And it's got to be
Okay.
stored in, they've come up with a dry ice, I believe. That's how
Okay.
they're going to transport it.
Uh-huh.
So, but it's only good for a certain amount of days, most likely. That's what I'm thinking.
Okay.
You know.
Okay. And then what I read is it's an mRNA vaccine, which we've never had licensed in the United States before.
Okay.
Because it doesn't directly put the virus in your body. It
No,
just
it's synthetic. It's a synthetic.
it puts whatever the ingredients are. Once it's injected into your body, it goes to the
Mm-hmm.
cells, and then it creates this what's called a spike protein,
Right.
which is found on the outside of the COVID virus
Mm-hmm.
cells,
Mm-hmm.
and that stimulates your immune system to
Right.
start combating and creating antibodies. So basically, it's
Exactly.
creating antibodies in your body. It's not giving you the COVID virus. You're not being injected with
No.
that.
Well, that's good,
Um,
right? I mean, I
yeah,
think
I
that's
mean, it
good.
sounds like it. It sounds like
Sounds
it
good.
makes sense. The only, again, a little bit of skepticism because we've never had that kind of vaccine licensed in the USA, but maybe this
Exactly.
will be the beginning of better, more and better vaccines.
Well,
Who knows?
yeah, and it's interesting how this, like Trump had his warp speed, right? And it's like it's just so interesting how every country just had to come up with it because it's not only a national emergency, it's a global
Right,
emergency.
right. Yeah, so
So,
that was great to see the medical community
mm-hmm,
all get together and try to battle this, kind of like you see in those movies with the
mm-hmm,
pandemics.
mm-hmm, mm-hmm,
So yeah, I have a list. There's like 5 pharmaceutical companies that are
mm-hmm.
working on different vaccines.
Right.
So they might come up with other ones too.
Sure.
AstraZeneca,
Mm-hmm,
Janssen, Moderna,
mm-hmm.
Novavax, and then Pfizer. So the Pfizer
Pfizer, yeah.
one is the first one that's ready to go. So they're going to start injecting people, and like you said, the elderly and healthcare workers first, which makes me feel a little better. I'm like, oh, I feel bad though. I feel
Oh,
bad for the healthcare workers because there may be some bad reactions. People
sure.
that have compromised immune systems already, or some kind of issues.
Well,
So I just hope.
so far out of the tests they've done, the worst thing that has happened is people have been getting headaches and tired, and that was like in 2% of the group that they tested. The only
Uh-huh.
negative things so far have been some headaches and tired from what I've read.
Yeah.
So,
Yeah.
and it's purported that it's 94, 95 efficacy out of the group between 65 and 84. They actually haven't tested it on anybody over 85 yet. So, but the
Mm-hmm.
people that are over 80 are going to get it right away after the healthcare workers and teachers and things like that.
Yeah.
You know.
Yeah. It's such a strange thing to happen. Because in our lifetime, I don't remember. I guess SARS, but there wasn't as much publicity about it, and it wasn't as
Well, interesting
severe.
enough, yeah, it wasn't as what's the word, contagious, right? And I think
Uh-huh.
but 800 people died. I know that's a lot, but compared to what's died, from COVID.
Right. Right.
Now, I was reading, which I thought was an interesting fact, that SARS-CoV-2 causes an acute disease, COVID-19. So it's the origin of COVID-19 is the
Mm-hmm.
SARS-CoV-2,
Mm-hmm.
which they had, which killed MERS too,
Mm-hmm.
SARS and MERS. But it's an infection that most people can clear on their own, which means there's a vanquishing immune response that a vaccine can aim to induce in order to protect people.
Mm-hmm.
However, this I just thought was kind of interesting that it's not true for something like HIV, which is a virus that there's no vaccine despite decades of research. HIV causes a chronic infection that integrates itself into people's genomes. So it's just kind of interesting that uh, there's no vaccine for HIV yet, but
Mm-hmm.
now we have COVID, which is good. You won't die from HIV anymore, but there's no
Mm-hmm.
vaccine yet.
Yeah, and that's, I think that's why some people are still skeptical about the COVID vaccine because they came up with it so quickly.
Right.
But, obviously, well, I don't want to say obviously, but hopefully they're not going to start injecting a vaccine that's going to kill off a bunch of people, because that would be a disaster on so many levels, in so many ways. It would be worse than any pandemic. So
Of
I'm going
course.
to have some trust, even though I am a skeptic. I'm always skeptical, but I'm going to have some trust that they've done enough tests. And I do want to point out, people that are skeptical of the virus and the number of deaths, and people that say they're not going to get a vaccine no matter what, and they're not going to wear a mask. And I understand, again, being skeptical, but in 2018 and 2019, I looked up the stats.
Mm-hmm.
34,200 people died of the flu. So
Mm-hmm.
with
Mm-hmm.
COVID,
Wait, how many? How many? I didn't hear that.
34,200.
Okay. Okay.
34,000. So they're saying, and that was on average. Actually, I think that might have been a higher year of
Mm-hmm.
deaths, or let's say average.
Mm-hmm.
Um, and so people that were saying that a lot of the COVID deaths were probably flu deaths and just attributed to COVID this year.
Mm-hmm.
I think that totally disputes that, because we are at about 279,000 deaths in
Mm-hmm.
the
Mm-hmm.
United States now.
Mm-hmm.
So if you subtract that 34,000, that's still 245,000 deaths.
Mm-hmm.
So we can't blame all of those on the flu too. So COVID is very serious. It has killed a lot of people. And then, something that makes me really sad is a lot of people say, well, it's older people. And I'm like, well, still, they're people. And
Right.
then they say, oh, they had diabetes, or they had some other
Underlying
secondary
conditions.
infection. Yeah, but they wouldn't have died from it. They might have had another good 3, 5, 10 years. But COVID combined with those secondary conditions is what, killed them. They couldn't survive it. So I feel like we've kind of been a little heartless about
Mm-hmm.
it. And I understand we take risks when we get in the car and drive, and
Mm-hmm. Mm-hmm.
there are risks we take, but I just feel like this is a risk we don't need to take. So
That's a good point.
why fight
That's a
it?
good
I
point.
do hope that people will take precautions and be a little more cooperative
And I hope
to
our
answer
country,
this.
personally, I hope our country, our federal government, whomever, lessons learned that there is going to be another pandemic. I mean, this is
Mhm.
not the end of pandemics. So we could
Mhm.
have saved so many lives, so much money if we would have just done it right the first time, you know?
Yeah,
It's like
yeah,
we're trying to play catch up, you know?
yeah. They waited too long, and yeah, we need a leadership. We need leadership that has a plan. In the past, we have, um, but it was confusing, and there was a lot of
Sure,
controversy. But that's why you have leaders. That's what their job is to make those hard decisions.
sure,
Um, and even now, we've got people that don't like the lockdowns,
sure.
and then you
Yeah,
have to weigh things out, our economy versus the virus, which is more important, because
right.
people will die because of a bad economy. But that can be money can cure a lot of issues, and especially when it's to deal with an economy.
Mm-hmm,
Because
mm-hmm.
there's going to be a lot of people becoming homeless now, because they're going to be kicked out of their apartments because they're not working. There are solutions to that, and there is plenty of money for those solutions. So
Right.
that's not really an excuse, but the failure to, I worked with someone who had COVID.
Mm,
She came into work sick, and I was training her. So she was new, and we were working really closely together. I was looking over her shoulder, for days, and she
mm-hmm.
wasn't feeling well. And she said, oh, it's just the change in the weather, and it's just because it's winter. And so I didn't think anything of it, but I worked with her, and here it turns out she had started her symptoms 4 days earlier, and she had COVID.
Mm-hmm.
But we
Mm-hmm.
were both wearing masks, and I went and got the test, and I thought, well, I must have it. I probably have it. And I was really tired, so I just figured I've got it. I didn't have it. So the
Great.
mask protected me, her
Mm-hmm,
wearing
mm-hmm,
one and me wearing one. So they do help. Maybe they're not 100% effective, but they do help. I don't like wearing one. I have asthma. I can't breathe. I hate it. I mean, my nose is all nasally and everything anyway. But if it's going to save me from getting that awful illness, and I've had several friends that have had it, and they say you don't want to get this. It's awful. And then of course the damage it does to your organs depending on where it settles in your body, and we don't know the long-term effects. So I do feel like we have to be, yes, skepticism is,
mm,
always should always be in our minds. We should always question things, but we have to learn how to use common sense too,
mm,
and
mm-hmm.
weigh out, like, wearing a mask doesn't hurt anything. It doesn't hurt you. It's uncomfortable, but it's not going to hurt you. So the mask wearing, then I don't know. What do you feel? Because our state isn't closed down. I'm in Wyoming.
Mm.
Oh, these people do not want to close anything down. Although the economy is suffering for some other reasons too, the coal and oil industry, but also
Right.
because people are still scared and they're not wanting to go out and eat and stuff. But what's it like in LA? I can only imagine.
Well, just I think it was today or yesterday they stopped the even dining outside for a while. Like since last week, we haven't been able to dine inside. Now we're not going to dine outside, so it's takeout only.
Uh-huh.
So that's kind of, I'm just a
Yeah.
little, I don't know why they're doing that because that's really hurting a lot of restaurants
Yeah.
here in LA.
Mm-hmm.
And so I was watching the news the other night and this one woman was like, I just spent 70,000 on making this outdoor thing and now I can't even use it. And I felt
Uh,
bad. So it's like so
yeah.
devastating to the economy. But
Yeah.
hopefully, I mean, that's another reason why I do hope the vaccine really, I do hope people take it and, knock on wood.
Yeah.
Fingers
That
crossed.
it
And by the
works.
way, I was also reading where you can get the vaccine once it's available is
Where?
Walgreens and somewhere else.
Okay.
I know for sure Walgreens and
Okay.
CVS. That's it. And
Do you have
insurance.
to have a doctor's approval, or can you just go and get the vaccine?
I
Probably like the
think
flu
you.
shot.
Yeah, I think you can just go and get it, and
Go get it.
all insurances are going to pay for it. It's being
Okay.
waived because it's considered a national emergency. So
Okay.
because I looked that up and I was like, am I going to have to pay for this? Is my insurance paying
Uh-huh.
for it? So that's good to know.
Yeah.
You don't
Yeah,
have to
that
worry
is.
about it.
That is. And
So.
when did you say that they're going to start it here in the United States?
Um, it's not for sure, but the earliest
Mid-December?
can be December 15th, actually, here
Okay.
in the States. But
Okay.
again, that's going to be for the essential workers, maybe
Mm-hmm.
teachers, people that are dealing with the public. And
Okay.
nursing, of course, nursing homes. They're going to go straight into the
Okay.
nursing homes
The
too.
elderly.
Mm-hmm.
Okay. Well, that's all good to know. Um, I mean, it's a really unfortunate thing. I do feel like sometimes our higher power is giving us challenges so that maybe we will slow down and stop and reevaluate our lives. I hope a lot of people are doing that, reevaluate our priorities as a country, um, being better prepared for things like this, and people sticking together and through thick and thin and helping each other. And
Since we're not going to be able to dine out again, it kind of reminded me of a little bit about the Great Depression when people were just, standing in bread lines. And obviously I wasn't there, but I just feel like I'm kind of living through our own little Great Depression, not even the Great Recession that we had in 2008. Oops, sorry, I dropped my
Mhm.
thing.
Yeah. Well, yeah, when
Dropped my thing,
I
sorry.
go by our food bank here in my
Mm,
town, and there's a long line of people around the block, and I get mad. I get really angry because I just think, why, how does that even happen? How are we, and then they're trying to ration food in the food banks because they're running out of food, and they're
mm-hmm.
asking for donations, and people are hoarding food because they're scared of what's going to happen in the
Sure.
future. And on the one hand, you can't blame them if you're trying to survive.
Right.
You're worried about what's going to happen in the future. But I just, I get really frustrated that our government hasn't come through for us more. All the people out of work. I'm from the restaurant and bar industry in LA, and all the businesses that are closing, and that thus putting people out of work. And the paycheck protection program, the
Mm,
PPP,
mm-hmm.
they're giving money to business owners, but the business owners aren't necessarily giving it to the staff, some of them. And
Wow.
so that's why I support that stimulus. Just give that
Yeah,
is always going to be the thing that saves the economy, is when you give people money. And that's how the
sure,
market is supposed to work. People have money, and then they determine who survives and who fails, the businesses that survive and
sure,
fail. And
sure.
so this is a chance for us to reset, instead of having a government that's picking winners and losers. Let the market pick the winners and losers. And the only way to do that is to give the consumers the spending power, thus money, and then they pick the winners and losers
Yeah,
in the
good
market.
point. Good point.
So,
Yeah, and supposedly they've come to some agreement that's going to happen maybe within a week or two. That they're going to be
well, I
sending out.
think it's past the House.
They're
Oh
getting
gosh, I can't
close.
remember. Yeah, but it's not going to be what it should be. It's not going
Right.
to be, it's
No.
just, again, giving money to people that don't need it really, or that
Mm.
aren't going to use it properly. That's not
Well,
going to help.
I think they're going to add some like $300 to the pandemic unemployment relief.
Hmm.
So there are at least people
But
that
it's
are
only, I think,
unemployed.
for a month. They're
Oh,
like
I don't
extending
know.
unemployment benefits for a month or something. It's very, everything's very temporary.
Okay.
And I don't know. I haven't done the research on that today. I mean, it changes every day. I've been trying to
Yeah.
follow along, and I haven't looked it
I
up today.
I just heard this morning it was $300, but I didn't know it was like a short term like that. But maybe it is.
Yeah.
You know,
And I
I
could
thought
be
it.
wrong, but I heard it was like they're extending unemployment benefits for another month. Um, and still, there's a lot of people that maybe not unemployed, but maybe their hours were cut, or their pay was
Hmm.
cut. I'm one of them. My pay was cut.
Sure.
And I'm not happy about that, because I'm working actually more hours now because
Sure.
I'm
Yeah.
salaried. So I'm end up working more hours, trying to make up for all the hours that everybody else's pay was cut. So, and that's a struggle. That's not, still we need to take care of all the other people that get sick. Maybe
Hmm.
they're
Hmm.
just sick for a week or whatever, and don't have health, or people to take care of their kids, the extra money that people are spending on childcare because the
Hmm.
kids are studying from home, so now you can't go to work, or you have to hire a babysitter, or there's so many reasons to give every citizen a stimulus check. Go spend
Hmm.
it,
Hmm.
let them go spend it, and the rich people will stick it in the bank. It'll be like pennies to them, but
Right.
so what, they'll pay it back in taxes.
That's
um,
true. We hope.
but that's really the best way. It's a no-brainer. That is the best
Yeah.
way to
Yeah.
stimulate
Now's
our
not the
economy.
time to like hold back the money. Now's the time because we don't want to see us
Yeah.
going into like I said, the Great Depression. You know.
Well, the angering thing is that with the CARES Act, or the first stimulus, is they gave trillions to Wall Street,
Hmm.
and Wall Street gave it to their CEOs as
Mm.
bonuses. As a
Oh
lot
my
of those
God.
companies still fired people and let people go, and that was just a mistake. But they didn't put any contingency on it. They
Hmm.
just
Hmm.
gave it out. And there were, a lot of those pieces of that program were misused, and we're
Hmm.
finding out
Hmm.
now that there were companies that got $10 million from the CARES Act, and
Hmm.
they didn't use it well. They didn't do anything to stimulate the economy. They gave out bonuses to their
Right.
CEOs, and
Right.
so a lot of mistakes were made. There were a lot of mistakes made. Um, in this.
So I guess how we feel about this vaccine for COVID is you and I both. We want you to investigate. We want
Yeah,
you to research it.
yeah.
And if you do get it, make sure you get the second one because if you don't get the second one, it's not
You got
gonna.
to go back for the second one. Yeah,
Yeah, it's not gonna
yeah.
count for anything.
Yeah.
It's not.
And I understand the skepticism. I think I support people being skeptical. I think you should be skeptical of these
Hmm.
kinds of things. But once you start doing you really have to use some common sense too. So it's
Hmm.
one thing to be skeptical, but you also want to use some
That's
common
true.
sense and weigh things out, do some real research, not just, me, I'm always like, turn off the television, turn off cable news. Don't listen to cable news. They are paid to tell you what their sponsors and donors want you to know. So do your own research. Go, look online and look at several different sources, and
Right.
until you feel comfortable that know what is the truth, even though sometimes we still may
We
never
still don't know the truth even when we know the truth.
about some things. So yeah,
Right.
I encourage skepticism, but I also encourage common sense with it. So as far as the vaccine, I don't have to worry about it right now because I'm not even allowed to get it
That's
at
true.
this point.
And we have a
There's
whole group of
enough.
people. we
for
have a whole
us.
group of
Yeah.
people that were going to go before us.
Yes.
Lucky us.
And I'm sure we'll hear, I'd be nervous if I was one of them, I'd be more nervous, but I'm sure we'll hear, if there's bad effects, and then they'll do some more research, and there's other companies that are coming out with vaccines too. So I as skeptical as I am of vaccinations, because I had a really bad reaction to a flu shot, I still feel like they some of them work. I mean, you asked
Yeah.
me to take a flu shot, never going to happen again. You'll have to hold me down to get me to take a flu shot.
Kicking and screaming.
Yes. But the COVID vaccine, I will consider it, after some time goes by and other people have
Well,
taken it, which makes me feel bad.
I'll
But
probably have taken it by then, and so I
okay,
can
as long
tell
as
you.
you're okay,
If I
you
keel
haven't
over,
grown
then
a
you'll
second
know.
head. Okay.
Yeah, if I
So
don't keel over and I don't grow a second head, then you'll know. Okay, well maybe
I'll
I'll
be
take
like,
it.
okay, Kimbra's okay, so I'll take it. But all of our systems are different, and there still is no
It's true.
guarantee that. So I still am going to be skeptical, because obviously I had the bad flu shot reaction. But
Mm-hmm.
what they're talking about, it's a different kind of vaccination.
Mm-hmm.
So,
Mm-hmm.
I
And even
possibly
people
be
like with,
okay.
I don't know, I was doing research about like even people that have, gosh, I better not say this. I don't want to say what I was just going to say because I might be not correct. So I don't want to say
Okay.
anything.
Okay. Yeah, we don't want to be
I don't want to
say the
mislead
wrong things.
anyone.
Yeah.
But
Well, okay. But our I guess in summary, what we're telling people is be skeptical, but also use common sense and do some research, and
mhm.
we're going to find out. I seriously don't think they're going to let a pharmaceutical company give out vaccines to people that's going to kill hundreds of thousands of
Right.
people,
Especially when they're doing it universally, like
or
England's doing it,
millions. Yeah.
Scotland, and
Yeah.
and then actually the rest of the EU is going to do it shortly. They have a system over there. It's similar to the FDA, but it's called something else. England's is a little separate, and they passed this vaccination. So now the rest of Europe is waiting just for their FDA
Approval.
approval. Yeah. So
Yep.
then they're going to do it the rest of Europe, and then about the same time as the United States probably. So
Yeah. Yeah. They
we're all
start
gonna.
theirs December 8th. So shortly after, the other countries will probably also um, join. And so,
Join in.
yeah.
And
So
remember,
anyway,
it should be free, hopefully. I mean, I don't know if you don't have insurance. That's the one thing I didn't look up. Gosh, but I'm sure it's going to
I
be. I
would
think
bet
it's
it's free.
yeah, I
Yeah.
bet it's going to be free, right?
Yeah. Yeah. Yeah.
Okay.
So,
Well,
anyway,
everybody,
stay safe, and thanks for joining us today, and we will see you next time.
yeah, we'll see you next time. Bye.
Bye.